this skill, I'm going to be doing restraints, and I will be using a chest restraint, which I've already applied for the sake of time, and I have a hand restraint. For use of restraints, we would have had to already tried other methods which were not working. The restraints would have to be used for the safety of the patient they're used on, or for the safety of those around them. We would also need a physician's approval for the use of restraints. I would have come in earlier, notified the patient and patient's family that is present that we would be using the restraints, which ones we would be using, and the goals of the restraints. I would monitor the patient's reaction to being told that the restraints will be used, and I would have given them the call light and left to go grab the restraints. I would have come back with the true restraints, using the nameplate as one of the identifiers to make sure that we were using the correct patient, knocked on the door, wait for the patient to answer to know that I'm all right to enter the room, and then I would either ask the patient for their name or use the patient's name as a second identifier that we are applying restraints to the correct patient. Then I would have applied the chest restraint, which has already been applied after I had washed my hands. I've already raised the bed to waist height. I would then lower the side rail of the side that I'm currently on to secure this side of the restraint to an immovable object on the bed, making sure that it is secure, but it will not come loose. I would then, making sure that it's tight, but it's not too tight where it's cutting off circulation. I would then repeat this process for the other side. And I'm now going to apply the hand restraints. I'm going to check for any discoloration of the skin, any breaks in the skin, and make sure that there's proper circulation running throughout the skin. We'll then apply the restraint to the wrist, making sure that there is room for just 2 fingers so that it is secure and will stop patient movement from harm of himself or others, yet it is not actually harming the patient itself. We'll then feed this through the loops to make sure that the Velcro binding it will not break, making sure that I can still fit 2 fingers in there. I will then again bind the restraint to an immovable object on the bed. Making sure that it's tight and will not come loose. It is not disrupting any circulation or discoloring the skin itself. And if I needed a restraint for the other hand, I would use that on the other side as well. Then raise bed rail again. I would lower bed to its lowest position, ensure that the bed is locked again. Make sure that call light is within patient's reach. Wash my hands. I would remove privacy, opening with up to the patient's wishes. If they wanted to keep privacy, we could keep windows drawn, but removing up to their wishes. Set the bed to patient's desires to ensure that they are still restraints are still effective, yet the patient is still able to be comfortable, wash my hands, collar is in place, and I would leave the room.